So here is the leadership myth that cost many people time and also caused paralysis. The idea that you need clarity before you can act, that the path forward should be visible before you take the first step, that the right move is to wait while the uncertainty resolves itself. My guest today is an engineer, a PhD in engineer, has built careers across mining, consulting, and national healthcare, talk about leadership, and has never once had the luxury of acting when everything was certain. She moved into healthcare, one of the most complex institutional systems in existence. Think about healthcare. Without experience in that sector, her background is in engineering, without an established network, without a map. She is now the CEO of a general practice advocacy organization shaping national and global conversations about preventative health and access to care. Her definition of clarity is the most useful one that I have heard in recent times. It is not about having all the answers. It is about understanding what matters most and make decisions with intention before the certainty arrives. Welcome to the Clarity Mandate, Dr. Susan Pearce, and I love to have you today.
Thank you. It's a pleasure to be here.
You have a PhD in engineering. You built a career in mining and consulting. And now you are the CEO of a national healthcare advocacy organization. Most people who move that far across sector do it gradually and with maybe a clear plan ahead of time. I would like you to walk us through the actual moment that you decided to move into healthcare. What did it make you feel like? Did you feel like it was the right move? And I just want you to walk us through that.
Look, it was an interesting time. I spent probably the first 10 to 12 years of my engineering career being very technical. And I do remember looking back on it, we had a philosophy that technical was the only way to be. But my company really supported me to take that next step to leadership and provided education. And that meant that I moved from being the lead design engineer to managing teams of different people in different types of engineering. And probably for the last 4 or 5 years that I was in engineering, I was managing lots of groups of teams and lots of groups. And so when someone approached me and said, "Will you run some general practices?" I had a philosophy of there are differences, but there are similarities. You're managing people, we're managing different stakeholders. So there's always an undercurrent of people. It's always making sure you can connect with people. That's what gave me the confidence to make that jump. And this was to run business, and I ran that business for 3.5 years. And then I was offered the opportunity to get into the charity. And I think one of the most interesting things I discovered during those 3.5 years of being in healthcare was I took a look. I discovered, I realized I needed external help. So I engaged coaches, and I've still got an executive coach because I needed someone to bounce my ideas off, and I couldn't always do that with my staff. But I'm reflecting on it. I went back over my career as an engineer, and I realized I had always been someone who had, I guess, a give back mindset. I didn't just go to work. I was on volunteer committees. I was on the standards committees. Every time someone said, let's make a change, I was like, all right, let's get in together a group. And so that was a real difference for me. And I identified, I do a lot of what's my values, what are the things that drive me, and identified actually a giving back mentality. And so in the end, when the opportunity to run the national charity for healthcare came up, like, you know what? I am a for purpose. I feel happier when I'm in a job that has a purpose and that giving back. It's not to say I don't like engineering and running projects, but my happy space is when I know I'm making a difference to people's lives.
Wow. Trained as an engineer, worked the engineering work in the background, leading the technical teams, learned the skills, got exposed to the human side, the healthcare side, the charity side, which was always something in the life of Dr. Susan. And you went ahead to define clarity as not having all the answers, but as understanding what matters most and make decisions with intention. I love that word, making decisions with intention. That is a reframe that directly contradicts how most organizations think about decision making, where clarity is treated as a prerequisite, I mean, for action rather than something that can come as you go through the decision making. When did you arrive at that kind of a decision or definition, and what was the cost of holding that kind of a definition? So I like you to get that because I mean
Ooh.
I speak with leaders and people would be like, I come from an economics background, practice as
Mm.
an economist for many years, and it's always about the numbers. Have you gotten your numbers right?
Ah,
Did you do the proper analysis? I mean, you're coming from engineering, and now you talk about you don't need to have all the answers before you move. Tell us about that.
look, I think it does come from engineering as well and having the numbers. It is something that is important to me. However, what I think the big interesting point is your numbers can tell lots of different stories. And I have a joke with one of the doctors that I work with is the most common answer that an engineer gives and that a doctor gives is it depends. If someone says, well, blah, 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 this is the problem I've got, what can I do? And you say, it depends.
Mhm.
And it's about keeping that open curiosity. What can we find? Thinking about the risks. And there are absolutely times when I find myself thinking about the risks and it doesn't, I'll think, hang on a second, I need to take a step back and think about the possibilities as well as the risks. But that is very much knowing the numbers, knowing the risks, but it's also knowing the risks also gives you all the paths that you can take. And I think the power of numbers as well gives you those paths you can take. So it's about thinking, okay, perhaps one of the best ways to put it is most of the time there are similarities. So what I really like to say is 80% of the time, there are a lot of similarities, whether it's in engineering, whether it's in healthcare, it's people, it's figuring out people's answers. And 20% of the time, it's you reacting to the solution. So making a plan and knowing what you're going to do for the 80% of the time. I like numbers, but it might be that 20% of the time you can jump in the direction that works for you. So you don't need to know what that is because you know most of what you're going to do. And that's, I feel like, after having worked in both industries, I think that's something really that engineering taught me. I don't know if you do it in the economics world, but we do things called hazard and operability studies before we
Mhm.
design something. We think about where it can go wrong, what we can do to prevent it,
Yep.
but we always have there is something unexpected.
Yep.
There are lots of similarities, but there's always something unexpected. So that's what gives me the strength because there's always something unexpected, but I can be certain about some things.
That's so true because at the end of the day, in economics, we would say everything being equal, assuming that nothing unusual changes as long as you're building this model. But like life happens, things happen, economic factors change, and your outcomes can be affected. But thank you. And someone tells you, "Oh, Dr. Susan, I am kind of paralyzed. I don't know whether I should make the move because I don't feel like I have enough information." What do you tell them?
Mine would always be do it. And I think I surprise a lot of my staff when they come to me and they say, I'm really sorry, I've got an opportunity. I don't know quite what I'm going to say. I mean, do it. I'm always so excited. There's a little bit of figure out how much information do you need to feel okay, and how much information do you need to oversaturate? So if you know everything, there's no point in doing it because it's not exciting. So uncertainty gives you a thrill as well. My friend and I were talking recently, when you stand up and you give a presentation, you always have that little bit of a rush of adrenaline. And some people, and I used to interpret that as fear and stress, but just putting a different lens on it, that you don't know what's going to happen, that uncertainty, that's actually excitement, that's engagement, that's anticipation.
Wow.
And I really found when I realized that is the same feeling, that excitement, that they're the same sides of a coin. And yeah, so I would be saying, well, usually I say give it a go. Just jump in and give it a go. But how much information do you need to feel safe? Because that's usually it's boring. And otherwise, just jump in and give it a go, because your feeling of fear is also a feeling of anticipation often.
Wow, this is so powerful. You put it so beautiful. Early in the week, our guest was from Denmark, and today we are having Dr. Susan joining us all the way from Australia, and it's past 10 p.m. her local time, and she's here on the Clarity Mandate with me, Dr. Vivian Atud. It's just a pleasure to bring clarity to our audiences across the globe. So let's talk about your current work, Dr. Susan. You work in general practice advocacy, which means you are working in shifting national conversations about preventative health and access to healthcare. These are inherently political conversations. I don't know about Australia, but other parts of the world, these are conversations that have multiple stakeholders who have competing interests. In economics, we say everyone wants to optimize for something. Politicians want to optimize the votes. In healthcare, we want to optimize the health outcomes. And sometimes politicians have to fund healthcare. So it's a little dealing with different stakeholders with different interests and sometimes no common definition of success, because what success might mean to a healthcare practitioner might be different from what success means to another interest group or stakeholder in that same kind of a campaign. So, how do you maintain clarity of purpose inside a system that is designed and structured with some ambiguity and kind of complexities and compromise, if you may?
Look, it is something that I talk to myself about. So maintaining the clarity and the purpose. And there's a couple of key things. I have people I talk to and I debrief with them. I have an executive coach, I have a values coach, and I have other groups of people that we debrief with. But one of those women who's been in advocacy for probably 35 years said to me once, and it really struck with me, said, the baton of change, it has thousands and thousands of fingerprints on it, and your fingerprints are just one of many. Since I've heard that, it has given me a lot of clarity, because by its very nature, it's a slow process. As to give an example, my company, I've been with them for 3 years, but we've been a part of the conversation for probably 10 years now. We've been advocating for breast density to be raised in screening profiles, because 17 years ago or so, breast density was identified as a risk factor 2 years ago, Australian screening started reporting on breast density. That's a lot of people over the years. And as someone who's worked in much quicker industries, 17 years to make change is a lot. But that image of the baton and handing it over, a number of people carrying it at once, that gives me a lot of clarity and helps me really to focus on what I'm trying to do. As I said, I have a values coach and I meet with her and I build my activities around the things that are core to my values. It's family, it's community, and those things help me focus and help me work with it. So because it's a long process to get change, and renewing oneself to keep focusing is absolutely critical.
Wow, that's so powerful. And I love the quote you just shared from your coach talking about the fingerprints, and you want to hand the baton with something. And sometimes, depending on the sector you are in, change might be quick. And in other sectors, because of the complexity and the multiplicity of stakeholders that are involved, change might take quite a long time, but it is worth it. And when you stay focused on your values, like you say, you definitely gonna make progress. But you went ahead and you described clarity as something that evolves. You say it comes from asking better questions, understanding systems, and being willing to act before everything feels certain. Most leadership development programs teach clarity as a state to achieve. Like now, you are in a clarity state, but you're describing it as a practice to sustain. I'm more inclined to your definition. What are some of the specific questions you ask yourself regularly to keep that practice active, to improve on your clarity so that it becomes a discipline, not just a philosophy?
Look, I do regularly ask, does this align with my values, my personal values? Does this align with the company values? And and is this something that there's a review as what's really important to identify an end point. I think we do talk about it a lot, fail fast, fail often, but the sunk cost fallacy as well, taking a fully honest look, and this is probably very much clarity, you take a fully honest look and you say, yes, I have invested time, effort, money, but it's not going anywhere. It's time to say, thank you for the experiences. What can I learn? Where does it add to my values? What lessons can I learn for next time? And these are really engineering principles. It's part of what we did when we wrapped up a project. Have a look back. What did we learn? But making sure you can feel that exit point. It's coming back to what's core to you. And I mean, for me, and I talked before, new things, trying new things, being open to new ideas, those are all some of another others of my core values. So it's revisiting them, having a look at them. Does this agree with it? Sometimes you might go down a path that doesn't for a little bit, and maybe it'll open up a new thing that you suddenly discover you're passionate about. And other times you look back and go, no, actually that path isn't for me. It's not lost. Nothing's lost from doing that. You've only gained experiences, people different things. And I think that's where I'll get a lot of my clarity from, taking that conversation.
Excellent. Let's push it a little further. Imagine a situation where you are under pressure and decisions need to be made. Does the same questions work in that scenario? Or do you need different tools for different intensities of uncertainty or pressure?
I've had a couple of them recently. We had a situation where someone approached us and we had to decide if they were a good fit for our business. We did have to decide quite quickly because they wanted to start us working with them in 2 weeks' time. And that was a matter of sitting down and I had to look at the company values. And I know what my personal opinion was, but I had to quickly talk to some other people as well to get a little bit of a, I guess, call it a pub test. I don't know if you guys call it that, but also the ask a person on the street. So we had to make a decision quickly because we needed to give them information. So we sat down, what are our values? We made it, we decided, yes, we are the type of group that will welcome these people. It does align with our values. We need to make sure these boundaries are clear. Yes, we can make this decision. So that was very much a bringing it back to the values. So yes, it really does work. Other times we have employee issues and I just hang up my hat and I go straight to the employee lawyers and I say, I don't know, this isn't, I think we should be doing this, but what are the legal reasons? So I would always prefer to go with my values, but sometimes we have to actually say we need a lawyer to help us.
That's powerful. And I hope that is actually helping someone out there have clarity in terms of dealing with this when things are okay and when you are under pressure and how do you deal with things. But you have also said clarity helps to reduce overwhelm. It helps in creating spaces that others can contribute meaningfully. That is a leadership claim, not just a personal one. Walk us through the mechanism. How does a leader's personal clarity actually change? What is available to the people that work with them or work around them? For example, you might want to talk about how does a leader genuinely influence the clarity of their team when the leader has clarity on their part versus when they are just performing and they don't have clarity.
Oh, for me, it's about getting them to engage with their values. And when I've done it successfully, what I've done is I've called my team in. We've talked about what our shared values are, what the important things are for us, and then we've tried to shape our goals around those. So I did this a few years ago with one of my teams. We had a session. It was a 2 hour long session. We wrote up what was important. We wrote up what our mission was, and we stuck them up on the wall so that we could see them every day. And we came back to it 2 months later and said, okay, which of these work in the everyday and which of these, in fact, aren't going to work, and where can we be a little bit wriggly? Now, for me, the most interesting part, and this is why I love workshops, is I walked into that meeting with an idea of exactly what we'd come out with, and I was at least 50% wrong. And that was the most beautiful thing. The group came up with a consensus that I would never have been able to come up with on my own, but it was a consensus we all together bought into and then could carry. So that's where I think giving that group, bringing that in, having that clarity, it's a joint decision, it's a joint discussion, and it's being available or being able to take on other ideas and say, my vision is X, but with these people's visions, I can make something even better,
Wow.
and we can make something better.
Wow, that's super powerful. And no doubt you have navigated three different sectors, distinct sectors through your career. And most career frameworks treat sector experts as primary assets. You go back to engineering or mining, you're an expert there. You go back to the business sector, you're an expert in what you practice. And now in advocacy, you are an expert in these different domains. So your career is actually a multi-sector kind of expert, composite expert. I'm looking for a word. So this is a different kind of asset. If we're looking at you as an institutional asset, you're kind of a different kind of asset, something that can be transferred across sectors. You go back to engineering, I think you'll do just great. That has more valuable kind of expertise and resources than the average leader who is a CEO in a healthcare advocacy organization. So I want you to share with our audience how moving from one sector to another has amplified or enhanced you to build multiple skills and assets that you actually bring to the organization.
I think I was lucky because it was always something that from the very start, mechanical engineering is one of those types of engineering that can specialize in almost anything. It's where you go where your interests are. And from the very start, I established my interests in a lot of different areas, and I found mechanical engineers in every single one of those spaces who had grown expertise. And some of them had highly specialized and they were very happy with what they're doing, but I could still communicate with them as a mechanical engineer. And that was something I noticed very early on. It's that generalist of the mechanical engineering. And it is one of the things we say we can be anything and can specialize in anything. And fascinatingly enough, moving across, again, I realized a similar general practice and that primary healthcare is a very similar philosophy. You're a specialist in everything. You're not specializing in, say, designing a steel beam or designing a piston. You're specializing in seeing the patterns that you need. And that's where I think I am a specialist, but I'm a specialist in seeing shapes, in seeing patterns, in seeing how things can fit together and how I can communicate with people and who might be able to help me. So it's a different type of specialty. I think I was really lucky because I did mechanical engineering. That is a lot of how the mechanical engineering field works. And really, primary healthcare, so passionate about that. It's that preventative. It could go in any direction as well, and it keeps people safe and well before they get sick.
Wow.
But the GP has to see everything and the mechanical engineer has to see everything. So
Wow.
generalist, specialist.
That's powerful. And one of the key messages is that if you are in a field right now listening to this episode and you have been contemplating, you don't have peace with your job, and irrespective of how skilled and talented and value you're adding, and you just want more, our guest today, Dr. Susan, is telling you you can leverage those skills in another sector. If you feel like you really want to add value, you can still transfer your skills to a different sector and still build capacity and assets in that industry, like she did, from a mechanical engineer to a healthcare advocate at senior level. That is really amazing. But think about it. Maybe one of the leaders in our audience is in the middle of a career transition into a sector they have never worked before. And I want to hear this from you because you've lived it. So they have strong transferable skills, genuine motivation, and significant anxiety. They're not sure. I would like you to give them two or three of the most important things uh, that they should do maybe in the next few days or the next 90 days as they consider this decision, so they can have more clarity on how they need to navigate that specific transition without waiting until certainty arrives. Like you said in your earlier responses, that if someone is contemplating a decision and they don't have enough information, you will still tell them to take up some action anyway.
Look, I think the first thing to do is really think about what your values are. And if you're in a position where you're thinking that you're not happy where you are, it's probably not aligning with your true picture of yourself. And you could do this on your own, or you can get someone to help you. There's online tools. And what's important to you? Which are the most important things? Does this fit where I am? How does it fit into whatever industry that I'm looking into, that you're thinking about? If you have a clear picture of a change that you want to make, a lot of the technical detail can be taught to you by the people that are there. The things that can't necessarily be taught is your experience in seeing patterns, is your experience in asking questions. Those are things that are fundamental to you that are absolutely transferable. And when you take them across, they will be the things that make you stand out. And the people who are there, if you're open, if you listen to them, they will be able to teach you the technical skills of the job. So if you've got something, think about what technical skills you might need to know. Is there something you can watch or someone you can talk to get that? If you're feeling unconfident, to get that ahead of time. Otherwise, have that conversation with the people with when you think about moving. But I think the most important, think about where your values align, because that will help you work out why you're not happy where you are, what's not fitting for you, and then why the next one will fit. Your skills as a manager are probably the most transferable things about you, rather than it being necessarily your deep knowledge of the field. That's certainly what I've started to find.
Wow, that's so powerful. Thanks for sharing that, and I hope it's useful to some of our listeners out there. Let's talk about the healthcare system in many countries, including Africa and across the developing world. There is just so much pressure on the healthcare sector. Talk about under-resourced, talk about political, contested, and expected kind of issues. They're trying to do more with less resources and global resources for healthcare, including things like even disease management or advocacy. These resources are drying up. And as a CEO who advocates for general practice and preventative healthcare at a national level, what do you understand about how change actually happens inside the complex health system that you are already part of? And to outsiders, think about donors, they're not outsiders, they're part of the whole stakeholders, policymakers, international organizations. What are some of the stakeholders getting wrong at this moment when it comes to healthcare?
Oh, look, when I think about Australia to some extent, and around the world, but in Australia, our government wants to keep saying healthcare should be free, that preventative care, we will pay for it, and then blaming the doctors for not providing it. And what they're getting wrong is they're forgetting, to be honest, that a general practitioner, the research shows, and this isn't just Australia, this is internationally, that $1 spent in preventative care, preventing someone from getting diabetes, preventing someone from having heart failure, can save $12 to $24 in the hospital. And it's it is very much, this is where I'm trying to still figure out this analogy, but it's very much about opening the beaches in Jaws. So you know the movie Jaws, they close the beach because of the shark, and the mayor says, no one's been attacked by a shark, so let's open the beaches again. When preventative healthcare is working, people say, no one's got diabetes. We don't need to try and stop diabetes. No one's getting heart failure. The numbers have gone down. And that is what so many government agencies get. You've spent 10 to 15 years running a program to reduce long-term health effects. And so everyone goes, oh, well, we don't have them anymore. So we don't need to keep spending the money. And it takes 5 to 10 years, because it's taken 15 years to build up, takes 5 to 10 years before it comes up again. And everyone says, oh my gosh, we've got to spend all the money in hospitals. We don't have any money to spend in primary health anymore because we're dealing with all the diabetes and we're dealing with all the heart failure in hospital. Like, yeah, that's because you stopped funding preventative care 5 or 6 years ago. Do you know what? That was 2 or 3 governments. It was 2 or 3 leaders ago. The short-term political cycle means they've forgotten, the community has forgotten, and we find so often in general practice in Australia, and I suspect it's the same everywhere else, someone will say, we've got this problem. And I'll say, yeah, because we had a solution 20 years ago that you pulled the plug out, pulled the carpet under, from pulled the rug out, pulled the plug out, and now it's come back again. Now, we do a lot of stuff very well, but that is where I think that's the biggest thing that I guess policymakers, funders say a stitch in time saves nine. But if you stop making those stitches, you're trying to patch up at the end. You're making all the effort getting people better from the sickness rather than preventing people having it. And that's, I guess, one of the big things. Our big project is breast screening. So catch someone as soon as possible if they've got breast cancer, which means they'll survive and they won't cost money down the track. But if people aren't participating in that screening, they won't get caught till later, so we won't be able to help their family, much more stressed. So yeah, it's believing in your programs and not just opening the beach because there's been no shark attacks.
Wow, that is super powerful because I think you've brought really great clarity to that question. And I hope some policymakers listening to this episode really digest what you're saying, that you can't stop investing in preventative health care just because people are getting better, because you just have to sustain. It's like I had breakfast and I'm all right. You're gonna need lunch, you're gonna need dinner, because you need that food to remain healthy, otherwise you'll fall sick. But that's so powerful the way you put it, Dr. Susan. Thank you very much for sharing that. And the name of this podcast is The Clarity Mandate. And I believe that there are moments of clarity in everyone's life, that clarity can no longer be optional when the complexity of a system, the pressure of transition, or even the weight of institutional expectations means that the absence of clarity is not just uncomfortable, but it is actively harmful to the people who depend on the leader's decision. So you have lived that kind of clarity requirement across different sectors, 3 sectors to be more precise. What do you now understand about what clarity actually is, what it demands, what it makes possible, and what it costs to build in honesty rather than to perform it, that you could not have understood it or learned it if you never had to sit on the seats that you have occupied?
I might be a little boring, but it's going back to being true to yourself. It's going back to self-discovery, and it's going back to continuing to keep that growth mindset and to stay open to learning. So, because clarity, it can change. I've certainly sat there and been absolutely certain of something, and then I've talked to someone, I've done some research, and I said, "Do you know what? It's not that direction, it's that direction." I don't necessarily 100% flip a 180, but do you know what? It's a rainbow of clarity. And that's, I think, I did not find that until I started being the one who had the sole responsibility and started saying, when I was working in engineering, I was part of a firm. I worked for the client and I did their job, and I never had to stop and think, what direction am I taking this business in? And having to have that responsibility, what direction am I taking this business in? Okay, where do I want to take it? I need to figure out who I am, what I am, and revisit it as well to make sure that you're not just taking everyone down a path that's changing and isn't working for you. So to me, I think that's how you can keep and you can get, and I've learnt clarity. It's asking those questions, revisiting those questions, and continuing to keep an open mind.
Wow, that's powerful. Thanks, Dr. Susan Pearce, PhD engineer, mining consultant, veteran now, and she is now the CEO of the National Health Advocacy Organization, working on changing how an entire country of Australia thinks about preventative health care across three sectors and one discipline. And I think that we could not have had a better guest to talk to us about clarity moving from one sector to another. Clarity in transition is actually been the key message and the key questions that you ask. So thank you very much, Dr. Susan. You did not wait till you became qualified. You did not wait until you came out of a medical kind of institutions so that you could get into the sector. You build clarity while moving forward by asking better questions and by understanding what mattered to most people, especially in the health sector that you are leading right now. And you did it across sectors. And we are so grateful to have you share these tips. And to every leader listening out there in our audience who is waiting to feel ready before you take that move. Dr. Susan made the mandate clear to all of us. Clarity is not a prerequisite. It is the product. Begin and let's continue to build whatever it is that you are building. Ask the right question. Make sure they align with your values. And we can't thank you enough. I am Dr. Vivian Atud, and this has been the Clarity Mandate.